So this is a continuing of week 1 for cardiac. We are going to be talking about diagnostic testing. So this is still week 1, but video number 2. So some laboratory tests. Some laboratory tests could be your white blood cell count, which increases from inflammation and infectious diseases. Some examples would be an MI, endocarditis, pericarditis. You can also have a decreased H&H, which reflects dehydration, shock, or hemorrhage. We're looking at the level of our red blood cell count, decreased in rheumatic fever, infective endocarditis. It increases with heart and respiratory diseases because of the inadequate oxygenation, which may increase O2 carriers. We also have some cardiac enzymes. These are special enzymes released during tissue damage that can be organ specific. So you have the CK with and LDH, which are found in all muscles, so they are not specific. The specific ones are your CKMB, which are specific to your heart muscles only. It can be detected around 4 to 6 hours after cardiac muscle injury, and this one peaks around 18 hours. You also have your CKBB, which is specific to the brain. So you can remember MB as myocardial, heart, and then BB in the brain. Troponin and your myoglobin are quicker tests for muscle damage. They elevate after 3 hours of injury and stay elevated for 7 to 14 days. Some other laboratory tests that we're going to look at is your blood coagulation test, which could be your PTT, PT-INR, and we've already discussed those. Also, we're going to look at the cholesterol and the lipid panels. You want to look at your low density lipoproteins. These are your bad cholesterol. You want it to be low, so you want it to be less than 130. Your high density lipoproteins are your good cholesterol. For males and females, although they are slightly different, you can remember 45. 45 is just a good number to go with. Males, they need to be greater than 45. Females need to be greater than 55. Remember, you want this one high. So high density lipoproteins, you want those high. Low density lipoproteins, you want those low. The very low density lipoproteins are very bad cholesterol. This is what helps cholesterol build up on the artery walls. You want this to be less than 30. You also have your total cholesterol. You want that total cholesterol number to be less than 200. We also want to look at our electrolyte panel, which could be the CMP or the BMP, specifically looking at our potassium, sodium, and magnesium. We also want to look at our BUN and creatinine. The BUN, we want it to be between 10 and 20. The renal function, which can affect the cardiovascular status. We also want to look at blood glucose, which should be 70 to 110 fasting. Arterial blood gases tells you oxygenation and metabolic status of your patient. Next, we're going to start talking about our diagnostic test. We're going to start with the electrocardiogram. This is a display of electrical activity of the heart. It measures the rhythm. It can detect tissue damage as the impulse cannot travel across the damaged area. One use is a Holter monitor. This is a continuous type of EKG worn by the patient over a 24-hour period or longer. This continuously reads electrical activity. Patients are not allowed to shower or bathe, need to keep a diary of activities and what was done when episodes occurred. Some are wirelessly transmitted, and some can be transmitted over a telephone. Another diagnostic test is the stress. Some other diagnostic tests could be a chest x-ray, which shows the size of the heart and the position of the heart. You can also have a CAT scan. It provides best information about chamber size, wall motion, valve function, and flow through the great vessels. With an MRI, you got to remember that they cannot have metal such as a pacemaker. Electrocardiogram, this is an ultrasound with an EKG to produce a picture of the beating heart. So this shows motion, heart structure, valves, if there's any strain or stress, and it can help with show the blood flow. A stress echocardiogram is an electrocardiogram under stress, such as a treadmill or medication if they're unable to tolerate exercise. Lastly, we have the Philium stress test. This is a test used with dye to be injected for an X-ray during a stress test. Here is a picture of what an echo could look like. A transesophageal echocardiogram is when a patient swallows a probe with a transducer for an ultrasound of the heart from the esophagus, if I can speak today. Keep patient NPO until the gag reflux returns. Another diagnostic test is the arterial and venous plethysmography. Blood flow test which utilizes the blood pressure cuffs to measure pulse strength. Can also use Dopplers to measure pulses, called the arterial or venous Doppler exam. Cardiac catheterization is the insertion of a catheter into the heart and vessels to get detailed information of the heart. Usually goes through the femoral artery at the groin. Dye is injected for visualization. Must have consent for the dye to be used, and you need to look at their bun and creatinine to make sure that their kidneys are getting rid of, the kidneys are able to get rid of the dye. Telemetry is placed on the chest to monitor the heart during the procedure. And what is the purpose of this test? The purpose can be, this test can be utilized for many different things. It can confirm the heart disease and its extent. It can detect congenital abnormalities. You can get a clear picture of the heart's anatomy. You can measure the blood O2. You can determine the cardiac output. You can infuse clot busters. You can perform an angioplasty and even get a biopsy. This is a picture of a person in the cardiac catheterization. Some risks that are associated with your cardiac catheterization is hemorrhaging, dysrhythmias, and allergic reaction to the contrast dye. So for a pre-cardiac catheterization, we always want to make sure we ask for allergies. We need to know if there's any allergies to iodine, shellfish, previous dye allergies, if they've ever experienced any. You want to obtain a permit. The physician has should have already explained the procedure, but remember, it's the nurse that obtains the signature. These patients need to be NPO. We're going to prepare the patient on how they will feel. Prepare them for that they will get a warm flushing feeling when the dye is injected, and a fluttery feeling as at the heart during the procedure. Prep the site. We're going to prep it with betadine. That will use local anesthesia, which is often used as a conscious sedation. So post-cardiac catheterization, we want to do our neurovascular checks on the affected leg. This is going to be every 15 minutes for 2 to 4 hours. They're going to be on bed rest for 6 to 8 hours with the legs straight. It depends on if their other devices are used and the point of entry that they utilized. We need to see if there was a plug used or if there are sandbags. This is going to help prevent hemorrhaging and closes the site quicker. An angiocardiography uses dye to reveal the size and shape of the heart chambers and great vessels. It also can tell the sequence and the time of their filling. Some hemodynamic studies are your central venous pressure monitoring, which is the pressure of the superior vena cava and right atrium as blood is returned to the heart. You can also look at pulmonary artery pressure. This helps determine pressure on the left side of the heart. It can help get your cardiac output, which is the amount of blood pumped out of the left ventricle into the arterial system in 1 minute. Remember, this is liters per minute. And you also can get your stroke volume, which is the amount of blood pumped out of the heart with each beat. So this is the milliliters per beat. There are nuclear tests, which are injections of radio isotopes to visualize abnormalities. This is an example of how they would go in to get your pulmonary artery pressure. Here are some review questions from both of your PowerPoints. What effects occur with aging in the cardiovascular system? I'll give you a few seconds to answer. Your answers are 1, 4, and 5. Remember, our blood pressure increases. This increases, and they become less competent. Here, what should the nurse note during inspection of the cardiovascular system? I'll give you a few more seconds to answer again. You should have had 4 answers. You want to look at their nail beds. You want to look for any JVDs. You want to look for capillary refills. We're going to look for any clubbing. After a transesophageal echocardiogram, what check must the nurse perform for patient safety? Is your gag reflux? Remember, the Homan sign shows a DVT, which we no longer utilize Homan sign. Palpation of the pulses. This is more after a cardiac, like my heart, cardiac cath. And this is to check your O2, which you could do, but it's not for the patient safety. We want to make sure they can swallow again before we give them anything, because we should know that this is part of the respiratory / swallowing tract. What cardiac biomarker is more specific for myocardial damage? In the note, they were actually written together. However, it is your troponin. Troponin is more myocardial specific damage.